Hello everyone, I am Dr. Ghanee. I am an oral pathologist. I see patients with oral lesions and oral cancer. I do biopsies, I treat those patients. Today I'm going to talk about dysplasia. Dysplasia basically means when a lesion has precancerous features. Let's look at this lesion. This is on the side of the tongue. So this is top of the tongue. This is the corner of the mouth. This is our lesion, and I'm holding the tip of the tongue. When you look at this lesion, you see mixture of red and white, and you see a pattern that we call it mosaic pattern. In GYN field, when they check female patients for cervical cancer, when they see this pattern, they always call it dysplasia. So the same thing we see in oral cavity. This is called, as I said, mosaicism or mosaic pattern, and I put these pictures here so you can imagine how similar it is. Usually this lesion is asymptomatic in the oral cavity. Patient has no idea about it and is usually caught by dentist or hygienist. That's why it's very important that we go for our regular checkup and cleaning. This patient had health issues, 72 years old, non-smoker, and he was not aware of this lesion. It was caught in 2014 first, and they did biopsies on it, and it did show dysplasia, and it came back in 21. When I saw the patient, I did an incisional biopsy. The result came back as mild to moderate dysplasia, which means precancerous features were mild to moderate. And usually when we see moderate precancerous features, patient needs a more extensive surgery. So they call that partial glossectomy, which means they remove this lesion and they go deep into the tissue to make sure everything is all removed, and the pathology will check the margins. Under the microscope, when we look at cancer, cells look very different from the cells of origin. They don't obey the physiologic rule anymore. They multiply, they become more and more, they make more cells. And also, they invade the surrounding tissue, they invade the blood vessels, they invade all the nerve bundles in the vicinity. With dysplasia under the microscope, we see changes. We see cells are not normal cells anymore. Their shape has changed. The way they multiply, they proliferate has changed. But with dysplasia, we do not see invasion to the surrounding tissue. So it's very important to catch precancer or dysplasia and get rid of it before it changes to cancer and invades to the surrounding tissue. And also, we don't want that metastatic lesion, that metastasis to happen, that cancer goes to other sites. Either local metastasis might happen or distant metastasis might happen. So this case is very educational because we see one of the features of precancer in the oral cavity. There are some white and red lesions and some other patterns of mixture of red and white that can be precancer. Sometimes some ulcers, they show precancerous features under the microscope. But this is one of the patterns of precancer or dysplasia that I wanted to share with you. As I said, most of the time, these lesions are asymptomatic and they are caught by dentist or hygienist. It's very important to go to our dentist and hygienist to get everything checked, not just the teeth. Also, periodically, we can check our oral mucosa and make sure everything is in normal limit. Thank you for listening. Have a good day.